If you've struggled with SIBO or irritable bowel syndrome, then you've probably come across this term called resistant starches. Should you be eating these resistant starches if you have SIBO or IBS? Should you avoid resistant starches? What are the benefits of these resistant starches? How do you know when to add them back to your diet if you've been avoiding them? These are all the questions that I'm often asked about resistant starches, and I'm going to answer these questions and many others in today's video. I'm Dr. Hagmeyer, and I'm the clinic director here at drhagmeyer.com, where we help patients from all over the world find answers and solutions to chronic health problems like IBS and inflammatory bowel disease and SIBO. And we use the principles of functional medicine and lifestyle nutrition to accomplish this. If you've never heard of a resistant starch, really quick, resistant starches are the foods that are found in things like green bananas and rolled oats and lentils, beans, chickpeas, rice, and most grains. And like the name implies, resistant starches are resistant to digestion. So what happens is that most of the time, these resistant starches end up in the large intestines, where they now become food for the bacteria that make up your gut microbiome. And while that's usually a good thing, for some of you that are suffering with SIBO, and for those of you who have a faulty ileocecal valve, this is another piece of the IBS puzzle that may be causing, contributing, and aggravating your IBS symptoms. Of these foods that I just mentioned, some foods, of course, are going to be higher in resistant starches than in others. And that's an important thing to know. All right? If you stay with me to the end of this video, I'll share with you my thoughts on which resistant starches you want to introduce back to your diet, when you want to introduce them back to your diet, and how to do this. Now, if you want good gut health, I'm talking long-term, long-standing good health, it's so important to understand and realize that the health of your gut really depends not only on FODMAPs, but all of these resistant starches. Now, I realize that this might seem a little bit contradictory for those of you who are out there that have IBS and have SIBO, but that's why I said long-term gut health depends on these foods. So you don't want to eliminate FODMAPs or resistant starches forever. I see many patients who come to my practice and they've eliminated these foods for 9, 10, 11, 12 months, sometimes even longer. Your ultimate goal should be to incorporate these FODMAPs and these resistant starches back into your diet at some point. This, of course, is going to vary from person to person, and while I don't know when that time is going to be right for you, what I will say is that your breath testing, food sensitivity testing, and your symptoms should all guide and dictate when this is safe to do. It turns out that resistant starches are not only important for gut health, but many other areas in your health that you may not realize. I want you to consider these 7 benefits of resistant starches and really why at some point you'll want to reintroduce them back into your diet when your body is ready. So number 1, resistant starches, they help maintain and normalize gut motility. They do this because they increase something called butyrate, and butyrate is a short-chain fatty acid that's produced when bacteria ferment carbohydrates and starches. Now, this is incredibly important for people with SIBO. Remember this, SIBO, first and foremost, is a gut motility disorder, right? And people with SIBO and IBS often have low levels of butyrate, as well as low levels of other short-chain fatty acids. We often see this on testing. Number 2, resistant starches help reestablish gut microbial balance. In other words, these increase the numbers of friendly bacteria. They increase the biodiversity of the gut. These are the good guys that obviously protect your body from the growth and the overgrowth patterns of bacteria that are disease-causing. All right, we want a lot of good guys in our gut. Number 3, resistant starches help bind toxins and they help eliminate toxins from the body. Now, most people with SIBO and IBS, leaky gut, they have a toxic bowel from this gut dysbiosis. So this also is something very important that resistant starches can help. Number 4, resistant starches help stabilize our blood sugar levels. They help make insulin receptors more sensitive. They increase insulin sensitivity in your body. And this is super important for those of you who are diabetics or people with autoimmune disorders, as well as struggling with irritable bowel syndrome or SIBO. Number 5, resistant starches improve cholesterol and triglyceride levels. Not much more to say than that, right? Who can't benefit from better cholesterol levels and more stabilized triglycerides? Number 6, resistant starches increase satiety. What this means is they make us feel fuller, right? And this can actually be a good thing because obviously, we have this epidemic, with obesity in this country, right? So improving the satiety centers in the body is also very important. And number 7, resistant starches play a vital role in B vitamin production. These are going to be things like biotin, things like folate, as well as vitamin K. Now, biotin, the biotin vitamin is actually very, very important because biotin, being one of those B vitamins, helps with things like hair and skin and nails. It helps with collagen production. Folate, on the other hand, is needed for maintaining healthy red blood cell production. When our red blood cells decrease in size or decrease in number, we struggle with fatigue, right? Because those red blood cells carry oxygen to the body. Another thing that these resistant starches do is they help maintain healthy homocysteine levels. This is incredibly important because this is a vascular marker of inflammation within our blood vessels. We know that high levels of homocysteine contribute to things like strokes and heart attacks. So again, this is the connection between the brain and the gut. We also know, for example, that these resistant starches help with methylation pathways. They help with detoxification processes within the body. Vitamin K production as well. Vitamin K plays a major role in blood clotting as well as bone health. So hopefully what you can see here and now appreciate is that these resistant starches are a necessity for long-term good gut health, right? Now, with all these benefits of resistant starches that I just mentioned, you might be inclined to think that you should just start incorporating these into your diet and thinking that they're going to get rid of your IBS or get rid of your SIBO. And so let me just exercise and just share with you one word of caution here, and I'll explain why. Before you do this, let me first say that there's a time and there is a place for resistant starches. Resistant starches have so many benefits, but if you are just starting out with SIBO or IBS, or you're just starting out on a low FODMAP diet, then I recommend that you avoid as best you can the majority of these resistant starches. And that's simply because that most people, these resistant starches can exacerbate this bacterial overgrowth. And that's really what we're trying to get a control over. So the key here when we're talking about these resistant starches is to go slow. Now here's what I recommend that you do. If you have gotten your SIBO and your IBS symptoms under control, and when I say under control, I mean that these are 70% better, 80% better, right? So in other words, your symptoms are 70 to 80% better. And maybe you have breath testing that has shown a substantial improvement in either your hydrogen levels or your methane levels or both. Then the next step is to start implementing these resistant starches back into your diet. But here's the key. You don't want to start introducing all kinds of resistant starches right out of the starting gate, or otherwise you're going to be back to square one with that bacterial overgrowth. Instead, what I recommend is that you first start out introducing these foods that are the lowest in resistant starches. These are going to be things like cooked rolled oats, white rice, brown rice. Now the key here is if you do this for a couple weeks and this goes well, maybe 4 or 6 weeks later, you try adding in another resistant starch, one that's a little bit higher in concentration. These might be things like yam or things like buckwheat. Now, in addition to eating the cooked rolled oats and the white rice and the brown rice, and if that goes well, maybe another 4 or 6 weeks later, now you try adding back in those foods that are even higher in resistant starches. These are going to be things like chickpeas and lentils. Now you can, in addition to the cooked oats, or the raw oats rather, now you can introduce some green bananas, maybe raw potato starch, right? Cassava starch. You can start introducing potatoes that have been cooked, heated, cooled, and then reheated again. That increases the amount of resistant starches. But the key here is to go slow and increase your resistant starches while listening to your body. Now, if you notice that you are experiencing more bloating or more gas or more IBS symptoms, you may have to back up for a few weeks and explore some of the other reasons behind the bloating, behind the SIBO, and behind the IBS. So again, the key here is don't give up on the resistant starches. One of the mistakes that I see so many people make is that when they start out going on a low FODMAP diet, and when they start to introduce these foods back into the diet, they increase the higher resistant starches right out of the starting gate. And it's no surprise that many of their IBS symptoms and their SIBO and their diarrhea and their bloating flare back up. Remember this, excessive amounts of resistant starches, or really any other kind of indigestible carbohydrate for that matter, can often backfire for a couple of reasons. Number one, as I've already talked about this, but it's worth repeating again, is that excess fermentable carbohydrates and starches may exacerbate this underlying bacterial overgrowth, okay? Number two is that excess starches and carbohydrates can exacerbate a fungal infection. Sometimes you might have candida or some other kind of fungal overgrowth that we see often in patients with IBS and SIBO. And finally, number three, excess starches can cause an increase in toxin production because, again, essentially what we're doing is we've just provided a smorgasbord of food to these bacteria, right? And so what happens is now they're repopulating. And again, that won't be good for your microbiome. So again, just remember this, is when it comes to these resistant starches, that you want to start out in lower concentration on the list, and over 4 or 5 weeks, introduce them slowly. Okay. Again, you're working up to this, listening to your body, listening to a combination of perhaps the symptoms that you have, maybe combined with some breath testing that you're doing, as well as food sensitivity testing. These can all, of course, guide that aspect of treatment. All right. So there you go. Hope you enjoyed today's video on resistant starches, the many benefits of resistant starches, which resistant starches you want to first introduce back in your diet, and also why you want to exercise some caution if you have IBS or SIBO. Now, if you visit my website, drhagmar.com, you can assess your risks of SIBO by taking my SIBO quiz. If you take this quiz result and it's suspected that you do have bacterial overgrowth, we will email you out our free guide on the low FODMAP diet. There's tons of recipes in there. It's about 20 or 30 pages long. We'll send that to you in a PDF. Just a lot of great information in there. And then also, lastly, if you suffer with IBS, SIBO, or any other kind of inflammatory bowel disease, and you need help getting to the root cause and navigating through all of this, reach out to my practice. I have a team of healthcare professionals that are passionate about teaching you how to strengthen and support your body so that you can avoid and decrease and even wean off some of these unnecessary medications that you might be taking. All right? Till next time, take care.